Hello. Okay. Yes. Oh, yes.
The people that are sitting here with you,
With Deputy Mayor.
Deputy Mayor, Angela McBride, Professor Monique,
Okay. Phela.
then Bazo Joyner, MEC.
Okay. I'm the middle. Guys, sitting at the sprayer. Just the team, the DS. Good morning. Deputy Minister in Leadership, we are about to start our meeting. May I request that we be seated? It looks like we all seated. I would like to request our choir there at the back to lead us as we sing our national anthem. Those who can stand, can we stand? Yes, thank you. The choir is going to lead us. Over to you, choir. Thank you very much, choir. My name is Nelisiwe Vilakazi from the Department of Social Development in the province. I will be directing this program this morning. This is an important day for us in the province of Kwa-Zulu Natal as we are hosting this launch. The launch by the National Department of Social Development, led by the Deputy Minister, Mayor Bogopane-Zulu, which is the launch of the South African Network of People Who Use Drugs. We are very grateful that out of all the provinces, Deputy Minister, you chose KwaZulu-Natal to be the province where this launch is gonna take place. We are grateful that there is good work and cooperation that is happening in terms of the support by the eThekwini Metro and we have the deputy mayor who is leading the eThekwini Metro in this event. Before I proceed further, I just want to request Mrs. Siza Mokhangwe, who is the Chief Director for Social Crimes and Families in the Department of Social Development at National, to acknowledge the guests that are present here today. Over to you, Caesar. Asimkhuthazeni ke ngezandla mayezala.
Thank you, Program Director. And good morning, Sanbonani. My name is Siza Mahangwe from National Social Development. My task has already been alluded to, is to acknowledge you and make you at home, because if we have not done so, it may be difficult for you to take off your jackets, to put your bag and all of that. So that's what we're trying to do this morning. We are here to acknowledge the guests that are here, as well as the ones that are online. I believe there are people that are connected online. But I'll start with the ones that are here. The first one is to acknowledge our Honorable Deputy Minister, Hendrietta Bogopane-Zulu. We know that she's one of the, one of our key people in making things differently and breaking new grounds. So we are grateful that she is here, and she's the one that initiated or piloted this project. We also acknowledge Mama Nontlantla Khoza, the MEC of Social Development in absentia. We also would like to acknowledge the Deputy Mayor from eThekwini Metro. Okay, it's Belinda Scott. The next one, Ndabezitha Mtuli. Mama Nelisiwe Vilakazi. Okay, I'll say the name, we clap again so that we follow each other. Mama Nelisiwe Vilakazi, our HOD, our Program Director. Mr. David Bayeva, Chairperson of Central Drug Authority. Just your hand so that they can see you there. Can you please come forward? Thank you. Ma'am Angela McBride, the Executive Director of the South African network people that are using drugs. I don't know if she's here. If you can just say, just show of hands so that at least we know her. Okay, there she is next to our DM. Dr. Renee Smith from the Dean Faculty of Arts, Durban University of Technology. Is she here? Oh, okay. Mr. Nicholas Human from the head, is the head of department from Durban University of Technology. As well as other representatives from DUT. Then from sectors, we've also have different sectors. We've got AIDS Foundation SA, Ms. Tulile Mbele, as well as Tembega Madondo. I don't know if they're here. Thank you. Also the sector TB, HIV and care, Calvania. Ms. Palisa Pili, CEO of Durban Chamber of Commerce. Ms. Hlengiwe Mhlaba, KZN Artists Fraternal. I saw them. Hlengi, where? Oh, outside, okay. Thank you. Mr. Walter Peterson from Sanka. Are they here? Okay. Mr. Vernon Goss, Choose Life Specialist Recovery Center. Are they here? Mr. Sam Pillay, co-chairperson of PASF. Mr. Niresh Becken, manager of Lenmet Hospital. They're not here? Okay. ANC Tegwini Regional Coordinator, Begin Tuli. Are they here? Okay. Mr. Chris Mbele, CEO of Gateway Hospital. Okay. Senior government officials, national, provincial, municipality, and all agencies. That is the list that I've received as far as the guests that are here. If it happens that we have missed you for whatever the reason, please forgive us. It's just human error, nothing personal. Then the next one is online. For the online, we've got our Honorable Deputy Minister of Employment and Labor, Mebuitumelo Muloi. We've got our international agencies, UNODC, Mr. Zulsh Akechiva. We've got USAID, Mr. Mugabe. And we've got other stakeholders that have connected. And then we've got a former RSA president, Ntate Khalima Motlante, who's a commissioner on Commission on Global Drug Policy. Then lastly, we've got Professor Mark together with her team who have hosted us, who made it possible for us to gather here, Professor Mark and the team. In closing, thank you so much for making this day a success. We appreciate this day because this is one of the programs that we are breaking new grounds. I thank you.
Thank you very much, Mrs. Caesar Mokhangwe, for acknowledging our guests. Can we give ourselves a round hand of applause? Ladies and gentlemen, you are all acknowledged. We are now going to request Her Worship, the Deputy Mayor of eThekwini Metro, Councillor Belinda Scott, to give us the welcoming remarks. Can we give her a round hand of applause, colleagues?
Good morning, everybody, and a warm welcome to Durban. Deputy Minister, it is such a joy to have you here with us today. SANPUD, I don't know if you can hear me. SANPUD, I must have got lipstick all smeared all over my face. I mean, the joys of the joys of masks. The SANPUD, TB, HIV, enhanced access and delivery. Madam Minister, this is my team. You're just sharing them for today. But I cannot tell you how honored we are as a city that you've chosen our Harm Reduction Centre to launch your relationship with SANPUD. I have also, and you have heard their names, I've invited Palisa Pili from the Durban Chamber to be with us. We've also got Chris Mbele from Gateway. There are other major benefactors in this room. And I just want to say that this is the second phase of a program that we started over lockdown, where where 260 young people entered into a harm reduction or substance abuse program, which was fully done by NGOs and the private sector through private sector donor funding, which made our homeless shelters by far the best homeless shelters in South Africa during the lockdown. The successes that we had were amazing. I got to meet some incredible homeless people. Many homeless people have been reintegrated with their families. Many of them have got secure employment. We ran skills programs in a lot of these centres, or our lockdown centres. We've scaled down now because our numbers are less, but we always, my dear friend Monique, Professor Marks from DUT, we always were earmarking this hall for the Harm Reduction Centre, and we were not going to let it go. And that's what you see here today. I mean, it is just amazing. And what, after, you know, the harm reduction program or drug substitution program that we were doing in our lockdown shelters, it now continues to happen here. But it's not just the homeless that comes here. For many of you that, if you don't know, if you don't have a medical aid and you can't get into a hospital, it's a two-phase program. The first is detox. And if you don't deal with detox, Mr. Mbele, you'll back me up together with any other doctors in the room, you can't get into drug rehab. It's particularly very severe substances, which a lot of our people are using on the street, which are heroin-based. It's almost impossible to get off these drugs without an opiate substitute. So that's where we've been using the South African National People Using Drugs. We've used them as our vehicle to raise money to make this centre work. So whilst it's an MOU between the university and the NGOs, but we are desperately asking, and that's one of the reasons why I've asked the business sector to come here. We are also going to be continuing these negotiations together with Professor Marks during the course of next month, because this is good for the city. It's brilliant for the homeless, but it's good for the city. That not only that we are a caring city, but it is actually providing destitute people a place to stay, which will be our safe open spaces, but also for people that are having problems with any kind of substance abuse, they've got a place to go to, and it's for free. Michael Wilson at the back, he works together with TB HIV Care and Match, so we don't just do drug substance abuse, we also do screening for TB, HIV care, and I don't know if you've been reading the papers recently, but during lockdown, TB has been left to one side, getting levels of TB. So this centre also does the screening of TB, HIV care, HIV, sorry, and it's so important what the centre, at the moment they've got about 200, Monique, I don't know what the capacity is, 2,000 if we had the money. So I'm coming out here, I'm abusing my place on this podium today for a hard sell to the business sector. I really want your money to make this program work. This is the first harm reduction centre in eThekwini. I thank you. And I thank you for my team. I love you guys.
Thank you. Another round hand of applause for our Deputy Mayor. The matter of substance abuse or harm reduction is everybody's business. Thank you very much, Deputy Mayor. If we are saying it's everybody's business, we mean everybody's business. I want to request KZN as artists fraternal to also give their remarks in terms of this day. They are represented by Miss Tlengiwe Mhlaba, that we all know. Can we give her a round hand of applause?
Thank you, Master of Ceremonies, Deputy Minister, and Deputy Mayor, and all the leaders, and ladies and gentlemen. We're talking about substance abuse and drug abuse. For me, I would love to understand what the substance abuse and drug abuse is. We are living in a world where it's a world of a relationship. Anything that we use, it's a relationship. Whether it's a person or whether it's a thing. We can use something for our benefit when we use it. But when you start abusing something, it becomes harmful to you. And when we are talking about some substances, there are some substances like medicine that we are given, but other people now are abusing it as drugs. So we are abusing what we are supposed to be using. So once you are so used into abusing something, you get addicted. And to get out of addiction, it's very difficult. There are two things that I know here in the world where people who use them are called users. One, it's drugs, and people are using social media. We are not called clients in social media, but we are called users because we end up getting addicted to social media. To social media. That's why we are addicted. I don't believe there is even one person who dreamt one day that I will become a drug user in my life. So we are saying to all people who are having problem with drugs, come forward, come to your friends, come to us so that we can help. You can't do it on your own. No one can do it on their own. We have institutions like the Deputy Mayor was mentioning that can help. We need to help everybody because everything starts, even if you can ask a person who smokes cigarette, when they started with, can you give me a scarf? They didn't start with the whole cigarette. And anybody who is an alcoholic, they didn't start by just buying the whole bottle of wine. They were in a party and they said, just have a taste. So that it starts there. So we really need to tell people that don't even start it, because once you start, it's going to be a problem. And I'm just appealing to our young people that we need to stop drug using, because some of us, we know when we're using drugs. We need to stop it. And you cannot control yourself when you're using drugs. We have a high number of gender-based violence, and when we can check, people are on drugs when they're doing all those things. A normal person cannot do that. So we need to curb the drug usage. And I'm saying, as Slengi Mhlaba, as an artist, we as artists, we are there for you. And most of our artists, we also have a problem because the society, they expect too much out of us. And some of us, we end up getting into drug using. So can the society allow us to be human again so that we can do things the right way? We are expected to be driving that car and not that car. So I'm saying today, drug use must stop. We are not going to leave anyone behind because we say, that one you cannot change. There is not even a single dustbin for a human being. We leave no one behind. We are saying we are going to be with you, we are going to stand with you, because drug use must stop and substance abuse must stop. Thank you.
Can we give her another round hand of applause? Thank you. The message we are taking is that leave no one behind. That's a powerful message. Thank you very much, Sis Hlengiwe. We move on with our program, ladies and gentlemen. I would now like to call the chairperson of the Central Drug Authority, Mr. David Bayer. She is going to give us setting the scene and some reflections. Over to you, Dr. David.
Program Director, Deputy Minister Social Development, Hendrietta Bogopane-Zulu, Deputy Mayor, Councillor Belinda Scott, UNODC and Abstentia Representative, Ms. Zeus Akashiva, Deputy Minister of Employment and Labour, Honourable Malloy, MEC Social Development KZN, Ms. Khoza, Senate Executive Director, Angela McBride, His Excellency Motlantla Commissioner of the Commission Global Drug Policy, UNAIDS Country Director, Mr. Mugabe, and our host, Professor Monique Marks. On behalf of the Central Drug Authority, I would like to express our appreciation to participate in your event and to publicise that the National Drug Master Plan 2019 to 2024 has been handed over to our Minister of Social Development, Honourable Zulu. It has also been accepted by Parliament as the country's response to address the national concerns regarding substance use. I would like to pay tribute to our Deputy Minister, Bogopane-Zulu, for initiating the collaboration between her department, the Central Drug Authority, and the South African Network for People Who Use Drugs in order to implement recommendations contained in the National Drug Master Plan. These are aimed to address harm minimisation interventions and to support those members of society with their specific needs, and as we just heard, to leave no one behind. After more than 3 years of consultation and research, the plan underscores social protection and health care instead of punitive measures of conviction and punishment. The evidence-based approaches seek to integrate services which will decrease the incidence of HIV, sepsis, TB, and promoting retention in recovery programs and aftercare for people who use or inject drugs. As the statutory body established in terms of the Prevention of and the Treatment for Substance Abuse Act 70 of 2008, the Central Drug Authority comprises members of private and civil society members who are appointed by the Minister of Social Development, together with representatives from each of the provinces and national departments, to, amongst other things, recommend to Parliament measures to be taken to address the scourge of harmful substance use and develop a national drug policy to reduce the demand and the supply of drugs and to prevent the use and misuse, but at the same time to ensure their accessibility for medical and scientific purposes through multi-sectoral cooperation. Further objectives: promote governance, leadership, accountability for an effective, coordinated, multi-sectorial response by strengthening data collection, monitoring and evaluation, and research to identify the new psychotropic substances and to understand their effects. It aims to stimulate economic growth for the purpose of reducing poverty, unemployment, and inequalities in the country. At the outset, it is important to emphasize that the National Drug Master Plan takes into account the United Nations International Drug Control Conventions, namely the Single Convention on Narcotic Drugs, 1961, the Convention of Psychotropic Substances, 1971, and the United Nations Convention Against Illicit Drug in Trafficking and Psychotropic Substances, 1988. The 9 chapters of the National Drug Master Plan contains all the information gathered after extensive consultation. For the first time in editing this National Drug Master Plan, the people who use and inject drugs and who are the target audience were consulted, as well as international and local stakeholders, the national provincial departments, local authorities, particularly through the local drug action committees, and civil society. The policies and the goals included: discourage the onset of use and abuse of substances by demand reduction policies, as well as control of production and distribution of illicit substance and supply reduction. More importantly, the National Drug Master Plan contains a section on harm reduction and makes reference to holistically treating users to mitigate the social, psychological, and health impact of harmful substance use by including needle and syringic programs, opioid agonist or substitution therapy, HIV testing services, and STI prevention. The National Drug Master Plan 2019 to 2024 is based on our view of harm reduction, which we believe is a more inclusive and realistic concept. There are well-researched, established, and successful harm reduction programs aimed at HIV and AIDS and other blood-borne infections. Rather than just accepting drug use as a subset, we are directing our efforts to accept harm reduction as meaning an effort aimed primarily to address and to prevent the adverse health and social consequences of illicit and harmful use of drugs where necessary, as well as reducing the HIV and other blood-borne infections. This would incorporate interventions in the field of criminal justice, education, healthcare, social support, treatment, rehabilitation, reintegration, and aftercare. Allow me to introduce the 5 principles as outlined in the National Drug Master Plan. The first principle is a rights-based principle, whereby the plan respects, protects, and promotes the human right to freedom of choice. Principle 2 is an evidence-based that allows for the plan to remain a work-in-progress document, which can be changed as new scientific and research evidence becomes available. Principle 3 talks to a multi-sectorial and a multilateral approach. The success of the strategies depends on several government departments and stakeholders cooperating in a coordinated multi-sectorial and multilateral programs. In Principle 4, the plan highlights all the socio-economic political issues which precipitate the illicit home and commercial cultivation, manufacture, production, and trafficking in drugs. Through the extensive consultation with people who use drugs, Principle 5 identifies how to use communities as inclusive and participatory agents for change. And what we are witnessing here today is exactly what Principle 5 stands for. It is proof of the resolve to implement and the recommendations as laid out that has been spearheaded by our Deputy Minister and by SANPUD. I again want to pay tribute to all concerned for the initiation of what we are witnessing this morning. To achieve the vision and the mission contained in the National Drug Master Plan, we have adopted the following goals, which were derived from stakeholders' inputs and again linked to the outcomes of the South African government's medium-term framework. There are 7 goals, and each of the goals included in the National Drug Master Plan has clearly set out measurable objectives or responsibility units in collaboration with other relevant stakeholders responsible for the implementation. The goals have plans on how to implement and how they should be executed. Goal 1 demands reduction through prevention and treatment of drug use, misuse, and abuse. Goal 2 talks to the supply reduction through the multi-sectorial cooperation. Goal 3 ensures availability of and access to controlled substances exclusively for medical and for scientific purposes, while preventing their diversion into the illicit market. Goal 4 identifies trends and controls of the new psychoactive substances. And Goal 5 is about promoting governance, leadership, accountability for a coordinated multi-sectorial effective response, including economic development and at a community level. Goal 6 promotes data collection, monitoring, evaluation, and research evidence to achieve the goals. In Goal 7, we seek to stimulate robust and sustained economic growth aimed at reducing poverty, unemployment, and the inequalities which lead to substance abuse and substance misuse. These goals seek to reduce the supply and the demand of the drugs for non-medical uses, increase harm reduction treatment approaches in the treatment of substance use disorder. Aligned to the goals are the indicators and the key deliverables. These indicator measures and monitor the goal implementation processes and are contained in an addendum to the National Drug Master Plan. There is also a risk management plan which aims to identify specific potential problems that may occur and will become evident through the monitoring and evaluation processes and how to address them. Sorry, I've lost my page. discrimination, and subsequent marginalisation by creating an enabling environment whereby all role players will contribute to the well-being of the people who use or inject drugs. It aims to reduce substance use disorder, the burden of disease, and related mortality. It will also contribute to the reduction in all forms of human abuse, criminal activity, gender-based violence, and violence in general. The National Drug Master Plan observes national and international policies, plans, and conventions to ensure respect and dignity for all people in South Africa. A concerted effort is required from stakeholders, including policymakers, represented and demonstrated this morning by the commitment of our Deputy Minister and Deputy Mayor, and SANPUD, and specifically the implementers, as witnessed here, being the activity of SANPUD in eradicating drug-related harms in the community. We are confident that this plan will usher renewed energy, investment, and efforts into the health and the welfare of many South Africans who will benefit from its implementation and your combined efforts. The Central Drug Authority salutes all concerned and looks forward to your success as an example of what benefits can be derived through commitment, cooperation, and your efforts. Thank you very much.
Here, they are all wearing masks and they're all maintaining social distancing. I think we need to acknowledge that. Thank you so much. I must indicate that leadership, we do have our important guests who couldn't be with us today, but they are connecting virtually, and they have an important message that they have shared with us. Right now, we are going to get a message of support from our United Nations Office on Drugs, who is Regional Representative Zuldi Akisheva. So our colleagues at the back will link us with a pre-recorded input from Ms. Akisheva. We acknowledge the MEC for the Department of Social Development who is with us now. Can we get the recording? Thank you.
Good morning. My name is Juldu Sakisheva. I'm a regional representative of the United Nations Office on Drugs and Crime. And it is my pleasure, on behalf of the UNODC, to welcome the launch of the South African Network on People Who Use Drugs, SANPUD, during the Social Development Month campaign. It is indeed remarkable that the event takes place in the Bilhaven Memorial Center, which is one of the best models for the provision of integrated health, including harm reduction and social services for people who use drugs. I would like to commend the municipality of eThekwini for ensuring that the services remained available during the lockdown, as the measures were taken to protect both the staff and the clients. Community initiatives proved critically important, especially in crisis times. Now, during COVID-19 pandemic, communities have demonstrated their unique ability to react quickly and reach out to those who are otherwise unreachable, having effectively easing burden on the broader healthcare system. In this regard, let me praise the work done by the South African Network on People Who Use Drugs for addressing emergency need of people who use drugs. SANPUD should also be praised for continuous advocacy for a human rights-based drug policy and access to the evidence-based services for people who use drugs. I'm pleased to acknowledge specifically a very excellent level of cooperation between UNODC, my team stationed in Pretoria, with SANPUD during the needs assessment of women who use drugs. That was a joint initiative, and we are proud to have partnered with SANPUD on such a critical issue. Our collaboration continues, and I would like to use this opportunity to invite all of you to join a webinar on 18th November, where we are going to discuss how to address the challenges and rights violations identified during the assessment. I would like to commend the National Department of Social Development on the recent adoption of the National Drug Master Plan. Its implementation will be successful only if the voice of people who use drugs will be accommodated and acted upon. The implementation of the drug master plan should be right-based, protects and promotes human rights, enshrined in the Constitution of South Africa. It should apply the evidence-based approach. Let me conclude by wishing SANPUD to grow bigger, to grow stronger, and to provide all necessary support. And that continues the very important work it does in support of people who use drugs. My office stands ready to continue close cooperation with SANPUD, and we hope it will continue for the nearest years to come. Thank you.
Thank you very much. That was the UN Office on Drugs and Crime, Ms. Akisheva. We are going to get another message of support from the country director of UNAIDS. He is Mbulawa Mugabe. Can you get that recording? Can we give him a round hand of applause?
Good
Mr.
morning,
Mugabe?
everyone. I'm delighted to join you this morning on this important occasion to launch the network of people who use drugs. First of all, I need to apologize for the fact that I cannot be with you physically, but I'm delighted to join. And I want to assure you that UNAIDS fully support this initiative, and we can count on our support going forward. I would like to recognize the leadership of the Deputy Minister of Social Development, my sister Hendrietta Bogopane-Zulu, who has been a real champion for this work. Let me also recognize any other dignitaries who are on the platform and also thank people who inject drugs, who use drugs, who joined us. In 2016, UNAIDS published a landmark report on HIV and drugs. The report was called Do No Harm, Health, Human Rights, and People Using Drugs. This report clearly showed us that the world was failing people who use drugs by not protecting their health and human rights. And this report provided a roadmap on what countries need to do to reduce harm and also to turn around those epidemics that are drug related. 3 years later, UNAIDS published another report called Health, Rights and Drugs, Harm Reduction, Discrimination, and Zero Discrimination for People Who Use Drugs. This report once again showed that people who use drugs continue to be left behind in our response. New infections among adults worldwide declined by 14% between 2011 and 2017. But there's been no decline in annual number of new HIV infection among people who use drugs. The United Nations has had a number of other high-level meetings, chief of which was the 2016 UN General Assembly session on World Drug Problem. And this summit, clearly there was growing concern that we need to be looking at people-centered responses and public health responses, which are human rights based when we deal with people who use drugs. And following that, in fact, the United Nations also had another summit, which was looking at the global AIDS response. And clearly at that summit, there was a political declaration which also tried to put people who use drugs at the center of the response, discussing issues of vulnerability and lack of access to services for people with, who are actually using drugs. And in that report, it was very clear that we need to do much more than we have been doing before. And clearly in the latest report that UNAIDS has released, UNAIDS is calling for countries to implement harm reduction measures that are comprehensive, that looks at how we can actually include programs that deal with needle syringe, exchange programs, opioid therapy, and so on and so forth. It also called on access to healthcare services for people who use drugs, which are respectful and are, in fact, ensuring that we respect their dignity and confidentiality, and making sure that they also have access to HIV testing, life-saving treatment, including treatment for tuberculosis and hepatitis C, and also for sexual transmitted diseases. It also called upon human rights and laws that ensures dignity of people who inject drugs. Now, when it comes to South Africa specifically, I just want to draw your attention to the fact that in South Africa, HIV prevalence among people who inject drugs is significantly higher than in the general population. With a population size estimate for people who inject drugs of about 75,000, South Africa has an estimated HIV prevalence of about 21% among people who inject drugs. And a recent study has also found that in the Tshwane metro, 58% of people who inject drugs were HIV positive. This is 5 times the HIV prevalence in the general population in the Tshwane metro, which is about 11.7%. Hepatitis C remains a major problem, affecting an estimated 55% of people who inject drugs. But also we have a much more challenging problem in the sense that we have very limited data on what's happening on TB and also on overdose deaths among people who inject drugs. So the newly launched drug master plan of South Africa, of course, touches on some of the critical aspects that we need to incorporate as we go forward in making sure that we have a people-centered, science-based approach and human rights-based approach to the issue of drug use. And I want also to say that I think what we have also learned during the lockdown period for COVID is that where there's will, and of course with the leadership of government and other partners, principally the Department of Social Development, we were able to see that it is actually possible for law enforcement to have a much more attitudes that are actually accommodating and supportive to making sure that people who inject drugs actually have access to services. The HIV response has been largely known for its community-centeredness. And I think this is not less true for our approach to people who use drugs. Communities of people who use drugs need to be at the center, and we welcome the launch of this network today, because this network will give voice to the voiceless, and it will also amplify the often very muted voices of people who inject drugs. So I would like to join this meeting this morning, just to welcome this initiative and commit our support as the UN system in South Africa and UNAIDS in particular as we go forward. I thank you.
Round head of applause, colleagues. Thank you very much. Thank you. That was Mr. Mbulawa Mugabe, the country director for UNAIDS. We are going to get entertainment now by Ubandile and Singobile. Asibakhuthaze Bandile and Singobile.
Greetings, everyone. My name is Ubandile Shezi. I'm a musician, specifically I'm a rapper. I'm on the methadone program. Before the lockdown, I was addicted to Wunga for over 10 years and I was staying on the streets. So the lockdown to me was kind of a blessing in disguise. I just have a little something that I want to share with you guys. It's just a piece that I wrote. It's called Dear Mr. President. Dear Mr. President, as I write this letter, the page is flooded with tears. But stash it, it's time to man up and face my fears. I just hope you take the liberty to hear me out. Because what I see happening on the streets on a daily hurts me, but I ain't screaming ouch. To see young girls prostituting for Wunga, standards every day, but izinto lutho kulunga. It hurts me ukubona umfethu ebulawa iforum, and same time ushawa now a roster. Sabaleke ekhaya cause umzali ubegosta. And now we here, siduba makhaya. Asisagezi siyanuka sesiphenduka ihlaya. Abanye bayasithuka ngapha abanye siyashawa. Ubush isiqwayi istina ngapha kukhala nedawa. They call us paras because Wunga left us paralyzed. But God will be the paramedic to bring the paracetamol to numb the pain. So it's the paranormal activity that took place in Calvary that will lead us to paradise.
Hey yo.
Hey yo.
See. What's up?
Ngazokutshela ngalaba ngiyakutshela bangazi bayitshela benjalo mangivela ba-right emaback bayangigwaza plus banokuswela ama-rhymes thus ngiyabahleka kanjalo cause lama-rapper yanxakana they trying to feel themselves ngathi ukuheva ngezandla plus ucash benganawo thus getting paid by the hour was kind of vague ule out I'm chasing the money till I'm dead in the ground nganudedela igazi ngasuphethe mnganami ngasuveza lwegani kube khona squeeze trigger kini geza lwebhadi. Better say it than it's done. Better pay me my bucks. Cause I cherish my art and I'm getting the bucks. Now you hate it, I'm now I got a brand new track. Now I got a brand new set. Get it? Now I gotta break you cats. Summer like if you chap. Get it? Banaba pay to shell. Genala my airport cats. Really got ish that'll take you back. Back to that bamboo pier. Now fill it. All I is what you really want. But you never be me, better give it up. Cause what I do ain't fair. Got my crew backstab. When I'm through with a fool, I'll be cool, take that. Hush. The mood ain't fair, plus I'm rude as hell, thus I move, I ain't scared from the boot to the nose, I'm a two-lane safe, must and cool play fair, guys, udujulo ngayijele it sucks, mangikhuza ungayekushutha uzo ngiyakubuka ungaqumba kusahlekwa, konke kunako vele kuphuma kumina ngasuthola ibhadi ugcina uqulekile bathi khona enginale lenza kuthuka iningi vele ugoba ubhawe mase kuphuma insimbi, what?
ngibela ngoba itax ngayigibela ngaduka enemali engekho grand ngabe ngaphuka iskrati saba iplane ngabe ngamuka like ngigezo olwandle ngibalekela ukunuka buka ngizange ngibalekela ikhaya ngihlale eceleni kwakhona la kudayiswa khona uphaya ngikhuza uhebe phela mina ngiphuma le emakhaya ngiyabonga.
Awe, siyabonga, siyabonga.
Thank you, thank you, thank you, Sebong.
Wow, ake sibaphinde futhi ubandile noSinobile yo. Thank you guys, thank you guys. This is best. This is best. Thank you. We are going to get another message which has been recorded by the Deputy Minister of Employment and Labor, Honorable Butumelo Muloi. Can you assist us there? You ready? Thank you. Can we welcome the Deputy Minister?
On the occasion of the SANPUD launch during the South African Social Development Month, we are at our best as a country when we confront big problems with big structural solutions. This initiative by the Department of Social Development to launch the South African Network of Persons Who Use Drugs is the step in the right direction. I'm also aware that the launch happens during the campaign of the Social Development Month, and this is very commendable, especially when there is so much uncertainty and anxiety in the country due to the pandemic. We pledge our support as the Department of Employment and Labor in the rollout to implement the comprehensive intersectoral strategies and programs of the Department of Social Development aimed at reducing the demand and harm caused by substance abuse outlined in the National Drug Master Plan of 2019 to 2024. We are proud as the Department of Employment and Labor to participate in this very important stakeholder engagement program echoed by the UN Sustainable Development Goals under the theme, Leave No One Behind. As the Department of Employment and Labor, we are aware of the high numbers of substance abuse cases of people in the workplaces. This can be a very complex matter to handle, especially if we are not focusing on the causes of substance abuse, the origin, the history, and the circumstances. The evolution of substance abuse in the workplace is overwhelming to many lives of workers, the employers, and leads to the collapse of many institutions of employment, and it destroys the careers. Surveys shows that the life of a substance abuser starts with a heavy alcohol intake resulting and leading to abuse of other substances. This affects the employee performance focus in the workplace and ends up very costly to companies or employment institutions. Family institutions are compromised, crucial responsibilities are neglected, and the well-being and entire health is compromised. Speaking to other people such as professionals can really help, but according to experts, the most reliable tool to manage substance abuse disorder is prevention and treatment. So this puts a heavy responsibility on the workplace in the case of employment and labor. Workplace programs aimed at towards identifying signs of substance abuse and assisting employees with treatment are of fundamental importance and therefore have a critical role. So in most instances, the right attitude, determination, and self-discipline will assist the victim towards finding a more meaningful and sustainable solution, especially for those who need help. This is a shameful, depressing life to live, no matter the circumstances leading to it. According to experts, substance abuse leads to a life disinterested into intimacy, loss of respect from those around you and other people, and it collapses your entire health and well-being. The entire generation is being consumed and decapacitated by substance abuse. Violence, acts of criminality, gender-based violence, sexual offenses, all other ills characterize our society today, and the advent of social media, other dubious innovations and technology add to the chaos. The sketch is very scary, dehumanizing and worrying. No matter how we look at it, we have created this phenomenon. Everything we create on this planet as human beings finds its first expression in the mind. At least everything that is the work of humans. We are no longer keepers of our brothers and sisters. We have allowed social media likes and dislikes to define our standing among friends and in the broader society. We have abandoned the teachings of our elders. We no longer see all elders as our parents. We have abandoned the community system of looking out for one another. We have overlooked the very subtle negative consequences of substance abuse and allowed them to grow bigger and out of control. We have abandoned our responsibility to be parents to our children. We are scared of our own children. We mollycoddle and tiptoe around the wrong things our kids continue to do. We do this because as parents, we blame ourselves for the conduct of our children more than ensuring that our children follow our value systems and teachings. We bury our heads in shame when we see our kids act out of character instead of reaching out for help. We choose to forget or ignore the fact that we are raising a totally different generation, and the pressure of being a parent in our times is totally different from how we were raised. This stakeholder engagement couldn't have come at a better time than this time we're in. And we thank you, Minister, for inviting us to participate in this very important discussion. We look forward for more social engagements and dialogues such as this one, and we wish all participants a fruitful day full of actionable solutions to heal our nation. I want to take this opportunity to thank you all for listening. Thank you.
Thank you. Thank you very much, Deputy Minister of the Department of Employment and Labor. Thank you for those remarks. They are very encouraging and informative. Ladies and gentlemen, we are now going to move on and receive a video by the South African Network of People Who Use Drugs. There is a video that has been prepared, and thereafter I will request the Executive Director of SANPUD to give the message for this August event, Miss Angela McBride. Can I hand over to you? Thank you.
Protocols observed. Thank you for having me here today. Thank you for having people who use drugs in the same room as this auspicious group. In 2016, when we first conceptualized SANPUD, we did not think this would be possible. It is through the works and efforts of the Deputy Minister and her team that South Africans are beginning to see that people who use drugs do have a valid contribution to make to policy decisions that affect them. These lessons have been learned from the disability sector and the HIV sector, and we thank the Deputy Minister for bringing them to the attention of so many people. SANPUD is hoping for just one thing: a world where all people are able and empowered to make well-informed, conscious, autonomous decisions about their bodies, including the use of drugs, without being criminalized, stigmatized, or excluded. We look for a drug policy landscape that does not perpetuate the oppression, marginalization, and economic exclusion of people, including those who use drugs. The response to drug use, lifestyles, or identity should not increase harm, restrict people's access to education, economic opportunity, services, and medications, or restrict their autonomy. This might sound like a big ask, but we are asking one thing only. Can we please align South Africa's drug policies with their fantastic constitution? It's only then that we will start moving towards a truly free and equitable South Africa. Thank you very much, and I look forward to engaging with you all in the future.
Hi, everyone. I was hiding in the corner, otherwise I'm in the way of the screen. Just first and foremost, I want to say thank you to everyone. I'm going to echo a few people today in the sense of I'm grateful for this opportunity. We as SANPUD are grateful for this opportunity. And I think I speak a little bit on behalf of the community that we work with and work alongside, that we're all grateful for the opportunity to be heard, listened to, and also to speak and share. I would like to thank our honorable guests, the venue, the organizers, everyone who made this possible. Because otherwise today we wouldn't be here. We wouldn't have experienced an incredible performance from Bandile and his colleague. We wouldn't have an incredible group of humans sitting in front of me right now. People who have grown with the project, grown with the program, and grown within themselves. I admire the passion, drive, and action that has been taken to bring all of this together. The adoption of evidence-based interventions like the OST program, the needle syringe program, and safe spaces is a step towards change. The importance of us as a community being involved and driving initiatives cannot be stressed enough. It is vital that our voices are heard. It is vital that these voices are incorporated into programs and systems that impact our lives. This event is a reminder that we are also human. This event reminds us that we matter and deserve the same amount of compassion and kindness that everyone else has and may face. The truth is that people are going to use drugs, whether we like it or not. The idea of a drug-free world is a utopian idea. If people are going to use drugs anyway, why are we criminalizing them? Why are we marginalizing them? We should be supporting, we should be helping. If someone is using drugs, we shouldn't be shunning them. We should be providing a service so that they can make a choice about their own lives. We should continue providing needle syringe programs, safe drug use education and information, OST programs, and evidence-based programs, not enforcing and forcing old systems that have been used to oppress. Once we've accepted the fact that we need to address substance use as a trauma response and less as a criminal response, we can start to change even more. Attention must be paid to challenge the destructive language, blame, as well as the drug policies that perpetuate this harm. We are not paras. We are not junkies. We're not Nyape boys. We're someone's mom. We're someone's son. And if your son, your father, your aunt sat here today, do you not want them to be treated with kindness? If they had gone through half of what some of these amazing humans have been through, if they had been turned away because they don't smell as nice or as expected, because they don't look the way that others do, how is that constructive and how is that addressing health? How is that providing support? Derogatory language, yet again, excludes us and removes our humanity. Don't assume you know me, and don't assume you know my story. Don't call me something if you don't know. Ask me. I'm a human. We can have a conversation. Just because I use drugs doesn't mean I'm a criminal. Just because I use drugs doesn't mean I'm going to harm someone. It just means I like drugs. It just means that I choose something different. If we can address this and we can make changes to support rather than punish, change can happen. We are humans and we deserve to be treated as such, regardless of what we choose to put in our bodies or do with our bodies. Thank you.
Can we give Angela another round hand of applause? Thank you. That was very informative and educational, Angela. I think we do need such talks a lot to our community so that they can learn and understand and support better. Thank you. We are now going to call the Honorable MEC for the Department of Social Development in KwaZulu Natal, Umam Nonhlanhla Khoza, to give us her remarks. Can we give her a round? Yes, thank you.
Greetings to the program director, the HOD for the Social Development Department. Greetings to the Honorable Deputy Minister. And I want to welcome you as well. Greetings to the Honorable Deputy President, the Deputy Minister of Employment and Labor, the Deputy Mayor of eThekwini, Mam Belinda. Hey, you've done wonders in eThekwini. That didn't go unnoticed. Greetings. Greetings to the representatives from United Nations Office on Drug Abuse, on Drug and Crime. Greetings to Mr. Mbulawa Mugabe, Director of UN. Greetings to everyone present here. I've seen we are gathered here as partners who are gathered here for one common objective, especially to deal with the monster in front of us, the drug abuse. In fact, we are gathered during the correct month, the month of social development, where we take stock of what we have done as social development and highlight what we should be doing moving forward. The testimonies in the form of performance by Ubandile and the team, and Angela's speech has brought us closer to the reality of what is happening outside. We highly appreciate it that some people, it takes a very brave person to give us exactly into eyenzekayo on the street, to the streets out there. And we need to give them a round hands of applause. It is heartening to note that SANPUD will make a huge change in the lives of the people, because we all know that taking drugs is often associated with all social ills that are experienced in our province and nationally. In the province, the city of eThekwini have hotspots, the areas regarded as hotspots because of being drug havens. As the department, we continue to fight we continue to fight the use of drugs among our communities, because we know it is destroying many of our good people, including our youth. We encourage that people who want to live clean lives to make decisions on their own, so that we can be able to assist them through the rehabilitation process. I understand that it is very hard for us or for families to decide on behalf of an individual, but it is more proper if the individual come up front in saying enough is enough, and it makes our work easier as social development, just to take them through the journey. Ladies and gentlemen, as we have noted from the presentations, the launch of SANPUD today is based on different pillars. Each pillar has clearly spelled out strategies whose full implementation will facilitate the transformation of lives and steer our communities towards a drug-free nation, as envisaged by the government of Kwa-Zulu Natal and the national government. In this province, Honorable Deputy Minister, the department interviews and profiles addicts should they present themselves at service offices, requesting assistance to be cleared of their addictions, or if they are referred by family or community members. We have 3 state-managed public treatment centers as follows. We have Newlands Park Center, Durban, which admits adult males and females and children. Which is number 2 is Madadeni Rehabilitation Center in Amajuba, which admits adult males, and the Kanyani Rehabilitation Center in Amajuba District, which admits children under 18 years. In addition, the department funds non-governmental organizations to render treatment services as follows. Sanka Durban, which provides inpatient and outpatient services. Sitholimpilo Rehab Center in Ugu, which provides inpatient treatment service to adult males and females. Heaven of Rest Halfway House in Tongati, which provides alternative care and reintegration services to adult males and females. Honorable Minister, we strengthen the provision of substance abuse prevention programs such as Kimoja, youth dialogues on substance abuse matters, education and recreation programs. We continue with the provision of early intervention screening and assessment of substance use disorders in communities. We continue to render therapeutic counseling, skills development and support services to people dependent on substances. Yeah, I want to agree with Ubandile when he says the coronavirus came with the negatives and positives. COVID-19 presented us with a great opportunity as a department to have access to more addicts. We had an opportunity to work with homeless people whose lives depended on drugs. The majority of the people housed in temporary shelters were linked to drug rehabilitation programs. We had a number of them who committed themselves to go through the process of rehabilitation, and they were monitored by the health professionals and social workers. The eThekwini municipality has done a great job to ensure that some of these people are exposed to opportunities, as we might have noticed the successful vegetable production. I must indicate that other drug addicts have been employed by our municipalities, especially the Newcastle municipality has taken some. Placing homeless people together in shelters has created an opportunity for them to work on some of agricultural projects, and people are now recognizing them by buying their fresh produce. We are thankful to the city and those who worked with the deputy mayor to ensure the success of the project. As I conclude, Program Director, we note with satisfaction that the monitoring of the implementation of the program will need us all as stakeholders and ensure our full commitment to help where we can. We thank the Deputy Minister for always being with us to ensure that we address challenges faced by our people without stigmatization. We call on the entire stakeholders involved here today to ensure that they play their part in ensuring that we are launching today in the province delivers on principle and key objectives of the National Drug Master Plan. As we are aware, there has been no collective voice of people who use drugs, and people who use drugs are not represented in any of the statutory bodies that inform policy or are responsible for the implementation of the National Drug Master Plan. We believe that one will change very soon. Minister, you are always welcome. Just come with whatever initiative which will make us a better Kwa-Zulu Natal. Thank you.
Thank you very much, MEC, for the Department of Social Development in the province. Can we give her another round hand of applause? Thank you. We are now going to get the launch of this program, which will be done by the Deputy Minister for Social Development, Bogopane-Zulu. She is the Deputy Minister at the National Department. She is Bogopane-Zulu. Ushade Zulu, Zulu bala Zulu Natal. Makota Zulu Natal. You are welcome to the stage, Deputy Minister.
Thank you, dear. Thank you, Sis Mary. Thank you very much. Please be seated. Firstly, allow me to apologize for being a little late this morning. I enjoyed a very nice eThekwini dinner, and I think as a Gauteng girl with everything spicy in eThekwini, I woke up with a very bad allergy. So I had to get that sorted so that I can stand here. So I think it's important that I apologize. Let me acknowledge you, Deputy Minister, Me Moloi. What we decided to do so that we don't, is everyone that spoke is here. But because network tends to disappoint, I became very proactive with Team SANPUD that let's even though they are going to be there, because they are connecting visual, let's pre-record them. You know, just in case the network is unstable and we experience, because I think as we host these events, MEC, we get better at it. And you pick up where are the loopholes. And I want to thank the team and the production team that allows us to send them this way, that way, this way, that way, even at short notice, at that speaker. So I would like to welcome and acknowledge, I always call her Sister Zuldish from UNODC. Thank you, sisters, for always supporting our programs and believing in what we are trying to do. We really appreciate. I want to thank Tate Mugabe. Thank you for allowing me to bully you and to remind you that UNAIDS plays a very important role, because we'll never get to 0 new HIV infections if we actually ignore those who inject drugs, because every blood-borne disease does contribute to our HIV prevalence. So, ke a leboga. Thank you, Deputy Minister, actually, because ama girls and ama gents, but they want jobs. So I like it because you committed yourself, eh? So they're not in this for mahala. Isn't it, ama gents? Yebo, yes. So you heard her, ne? She's there in the platform. So we need to make sure that ama girls, nama boys, and ama jobs. Deputy Minister. So we accept the offer you made, and this program will be supporting ama girls, ama boys, to get them to go back to functioning normally and for them to get the jobs. So we thank you for the partnership, and we also thank you for making available and committing that some of the money will go towards centers like the one we are launching today, to actually build the skills of our drug users. So, I also want to thank MEC. Thank you very much, MEC. And I hope you heard Ngobile and Bandile, because stigma, it's a very painful thing. Unless you've experienced it, you actually don't know what it means. But Ngobile and Bandile, vele vele, noma ibanganibiza amaphara kote paradise sofika sonke. Ngiyentshela. Noma banganibiza names your parents didn't give you. We might be queuing thank you, ma. We might be queuing together at the gates. My daughter always say, when St. Paul welcomes us, and you'll go in Mchana while I'm looking for my ticket. When I was thinking I'm better than you. And then when you andlula nje, like, yes, welcome to heaven. And then next, yena lo beka mestrati nakubiza iphara. Uyena sekabuka wena, and then it's like, sorry chief, it looks like your name is not on the list. So paradise, hey, nalaba bangwele mchana bazohlangana nawe emnyango. Babone wena undlula, babe bebekulabela all your life for a mistake or a bad choice or influence that they never even cared to understand. I want to thank Angela and Sean, and to confirm that, sometimes as we are given these positions, to say to Team SANPUD, thank you for making me and welcoming me in your space of people who use drugs. And like Sean said, I didn't just pop up to launch the organization. I was there long before it was even conceptualized. And we conceptualized it together with Sean. We sat, I remember the whole night in my Cape Town office, thinking about this thing and looking at how. And that was in 2014, for your information, as it finally happened in 2016. So I'm not launching something I don't know. I'm launching something that I've been part of. Opomalus. Outside. Umalusi would tell you the hours when I come to Durban, where we would sit 3-4 years ago and talk about SANPUD. And highlighting how we are going to do this thing. Where are we going to get the money? Who is going to listen to people who use drugs? Who cares enough? I was there. So I'm explaining because sometimes people think we just rock up and pop up and then you standing with the Caesar. No, I don't do such. And I don't launch something I don't understand because I always say, me, I'm a brand on my own. So when I attach my name and my signature, it means I'm ready to live the cause. And it took a lot of hours. I spent a lot of time with people who use drugs. I remember the one time we woke up at 4 o'clock in Hammanskraal because I wanted to have a session with people who use drugs. And I remember somebody saying to me, hey, if you want to talk to people who use drugs, you must be there at 4 o'clock before they get their first fix. So you get all the truth, nothing but the truth. And I left home at 3 o'clock. And at 4:30, we were there and I was like, hey guys, we are thinking about having an organization. How would you feel about it? And because the pushers had not arrived to get the first fix, I got the truth and nothing but the truth. You know, you get the truth. Isn't it, Angela? Yeah, that's how it works. So when you hear, you know, isn't it ngo? Yeah, figure early. Ube woqala staff singakafiki. So that singakaqali indaba zethu bese wena utholile ukuthi this that you have in your head, will it work or not? And I want to thank you, Prof, because without research and institutions of higher education and professors that actually believe in human beings, I always say, you know, not everybody that has a PhD and is called a professor is actually fill in the gaps. But when you have academics who care, but who also put their research in context and not write to glorify their own names, but write to give evidence to people like us who draft policies and programs to actually make informed decisions. So we really appreciate you. And we appreciate each and every academic. Each and every academic that continue to assist us and give us the body of knowledge. I want to appreciate David and the whole team from the Central Drug Authority. I appreciate them because when I arrived at social development in 2014, amongst the things that I had to deal with was the issue of drugs. And they welcomed me, they allowed me to lead them, they allowed me to agree and disagree with them, they allowed me to actually be me as the Deputy Minister. I want to appreciate Team DSD from all national, province, and local for allowing me to say this way, guys, and not that way. Because sometimes, I must tell you, as a politician, when officials of government don't want to do what you want, they'll give you all the reasons, They will make you convinced that this that you are talking about won't happen, and trust me, it won't happen. That is one thing I've learned being in government, is that unless you sell whatever product you are selling to officials of government for them to buy it, doesn't matter how many hours you can spend screaming, shouting, they ain't gonna do it. So I want to thank Team DSD. It took a while to get them there, trust me. It didn't happen overnight, but they hear and they understand the principle of people-centered, human rights, and above all, self-representation. Okay, perfect.
self-representation. Now, I believe in self-representation because born as a totally blind girl in the village of Pukeng, as my parents' first child, after 5 years of marriage, then they expected my mom to give birth to a boy. She gave birth to a girl, and a blind one for that matter. So that didn't go so well, I must say, because then the whole village came to see this blind girl, like I was on the circus or being exhibited. But nobody believed that I'll make any progress because they didn't have enough faith in me. But I always say my parents had faith in me, and that was enough. And they made sure I went to school, even though it was more than 3,000 kilometers away from home. They made sure I did. Now, I'm not here to actually think I'm better than any, no. It's because I've been discriminated against. As a disabled person, as a black rural woman, I've lived through stigma, and I understand what it feels like to be different. And that is what we are here about, is to actually understand that stigma divides people. Stigma creates unnecessary class and status. Stigma gives people the wrong belief that they are better than you. But actually they're not. Because each one of us, whatever that happens in our lives, it's a journey, because they say God knew us before we were even formed. And in the journey of life, there is pros and cons, there's mistakes, there's bad choices, there's bad decisions. What is important is that you acknowledge them. So to the girls and the boys, we call each other that. To ama girls and ama boys, nobody should ever judge you on a mistake you made. They only have the authority to judge you on what direction they gave you. And that's the only thing they must account for, and that is why I'm standing here. It's because I want to be counted as somebody that said, guys, here is Indlela. This is where we are going. Yes, you made the bad choice. You got the bad break. Let's empower you with information that can assist you to come out on the other side. Because sometimes we think rehabilitation is the panacea of everything. But rehabilitation starts with the inner person in me. Angithi bandile? You can send me to the most expensive, fancy drug rehab. If angalungi mina la, and angaba ready la, ngizofika ngibe irobot laphayana. And I will listen to this social worker who's telling me all sorts of stories, listen to this psychologist who's trying to tell me something, and then finish my 6 weeks program, government spend money, MEC, and then I go back to the streets and I continue with my drugs. And then when I feel I'm overwhelmed, I go back to rehab, so it's a revolving door. But we're launching SANPUD today for a few reasons which I want to give. So that even our media colleagues, which we welcome and thank them for continuously holding us true to our word. The first thing I said, leaving no one behind cannot be a fancy UN slogan. It must be practical and real. So as a disabled person, as a disabled South African, it took a while for me to be heard, to be given the space, to be recognized, to be acknowledged. And today, we stand here to give a voice to people who use drugs. Because unless their voice is heard, their story is told, we will forever design programs that sits in our heads and never change anyone's life. That is why SANPUD is very close to my heart. Because with those voices, we will get to understand and to deal
with that which led me to the need of drugs in the first place, and not necessarily chasing the drugs themselves. We're launching SANPUD today because we believe in the principle of a people-centered response. And you cannot say you are going to write that in the Prevention and Treatment Act, but you never create the platform to give them a voice. So people who use drugs, it is only through your own voices, it is only through your own stories that we can actually design policies that take you further in your lives, that are supportive, but also responsive. We stand here to launch SANPUD, not because we are here to promote the use and abuse and misuse of alcohol and substances. No, but we believe in the power of support. We believe in the power of togetherness. We believe that rehab will make sense when you are peer counseled by the one, not that read it on the textbook, but the one that walked the journey. You will hear them better, and therefore we're saying, we're launching SANPUD today because we want you to have a united voice. Because divided, you will never even recognize that the door is already open. You don't have to kick it now. You already have a seat on the table. Just put your issues. I believe very strongly, because I've walked the road, been there, done that, and I have the t-shirt to show for it. Unless we strengthen the voice of people who use drugs, drug policy will always go the opposite direction. And today I stand here very proud because I know for a fact that the change we want as social development, the prevention message we've been singing, the services that then we don't know whether they're working or not, will work because those who use drugs will lead the way. So we're launching SANPUD because we want you to lead us. We want you to lead each other. We want you to rely on each other. We want you to be each other's keepers because in together we stand strong. But divided, the drug pushers will always win. So we launched SANPUD today because we're saying to the drug pushers, which we know some of them are here, because they want to make sure they know what we are doing, because they're always a step ahead of us. But we're going to unite the people who use drugs so that they can stand against those that sell the drugs to them. And that we strengthen the voice that says, no, not in our name anymore will you destroy generations and generations of young South Africans. And I know it will happen. I'm choosing to disrespect somebody who didn't sleep and wrote this very fancy speech that I'm supposed to be reading. I want to apologize to Team Deputy Minister, but thank them for allowing me to scream and shout at them all the time as I get these things done. You're really special guys, and we talk and we plan and we're here today. David spoke a lot about the drug master plan, so I'm not going to go into it. But one of the things we got right with this drug master plan is we were all in agreement that unless you elevate the voices of drug users, you will forever write strategies that doesn't work. I think I'm amongst the most controversial deputy ministers in government. I don't know whether it happens by, the other time it was me and the sex workers. And I was told, and everybody was like up in arms. And I reminded everyone that actually we're all sex workers. So the sooner we stop pointing fingers and calling sex workers names, start pointing the finger at yourself. And today I want to say we're all addicts. It's just that the addiction of others is more pronounced, and others think we have it under control. And I always say to my team, you see, when you start drinking more than 3 cups of coffee a day, you're on the road there. Addiction. So stop thinking just because I stand at the street corner and get the cheapest wunga with Retex and everything, whatever concoction, makes me better than the 20 cups you drink a day of coffee. It's just that coffee just happened to be legal, but it's just as addictive. So one of the things South Africans must learn, we judge in a hurry. We take our moral standards, prescribe them, and think it's the truth and nothing but the truth. So help me God. No, it's not my truth. Because when I met the drugs, I had a problem. And the social worker wasn't there to listen. The psychologist wasn't there to listen. My parents didn't hear me. My teacher at school had too big a class. And I ended up in the streets, chasing something that hurts, something I'm trying to deal with, and nobody created the space. And when I found that one thing that gave me that comfort, it ruined not only my life, my reputation, my career. It also ruined everyone around me because I became the thief. I raped. I broke into houses. I disrupted the peace of the community because nobody stopped to hear my cry. Sometimes silent without speaking. So let's not judge in a hurry. The first thing is, what did you do? When I could not voice out, did you hear me even when I was silent? But we also launched SANPUD today to make a call to women. Because history has taught us that women don't reach out for help. So whether we're going to call you service users, whether we're going to call you recovering addicts, whether we're going to call you paras, it doesn't matter. Whatever label, I'll tell you as a disabled person, you're either differently challenged, physically challenged. Everybody has a label that they call you. And to take in all of those labels, I've always said, call me whatever you like. The only responsibility I have is to know who I am, so that I can accept whatever name you're going to call me. It should not pull me down. It should push me up, as Bandile and Mobile said. So guys, I don't want you to be hung up on what you want to be called. Disabled people can teach you a thing or so. We've been there. We've fought, we've invested time on worrying what are we being called, and during that time we lost valuable time. Yes, there's power in language. Yes, there's power in words, but let them be words that help you to stand firm. And if there's a sector you can learn a lot from as you get your seat at the table to speak for yourself, to be heard, it's the sector on disability. They have a thing or two to teach you. But I also think women have a thing or two to teach you. Because trust me, the women's movement has gone through what you are about to go through. Because today, Prof is going to say to you, don't allow them to call you addicts. And then you spend hours arguing, and Angela is like, yeah, don't allow them to call you service users. Don't be stuck up in that. Your role and responsibility is to demand good quality services. How they define who they gave those services, don't even care. Whether you provide the service to the para, I want that service. And that is what matters for me to get on the other side of the ocean. So don't get obsessed in whether today the deputy minister is going to see you a recovering addict. Find the positive in the recovering addict. That yes, I am an addict, own it. And for me to remember to be at Belhaven Memorial Service on time for my methadone dosage, I must never forget I am an addict. So that I never forget I must be there on time. So take the positive part that says, yes, I am a recovering addict. I shall never be cured, but let me be there on time. So that I never forget that I must have. When they say you are a para, you're like, oh yeah, parasite, right? So I'm there to steal and whatever, fine. What is positive? And I liked what you said. Because in the para, you found something positive. Whether DSD is going to tell you are the service user, just use the service, fine. Can the service be there for me to use? So you can call me your service users in your program or whatever it is that you want to achieve, fine. Just bring the service, that's the only thing I'm interested in. Never allow politics, policymakers to detract you, to keep you busy with useless things. Because, we can, we'll put you in a room and call you to 100 workshops to say, define yourself. Do you guys want to be drug users or addicts or... And then you're obsessed while we're not providing any service, and financial passes and Sis Nelly sends money back as the HOD of KZN. Mara, she can tick the boxes that I had 5 workshops with them. What did you guys discuss at the workshop? Whether we want to be addicts or service users or recovering addicts or what? Don't allow that. Because I can tell you we lived through that as disabled people. We got kept so busy in the definition of disability that we lost a valuable time, and they were too happy to even tell us every day, you are not united. We can't talk to you in too many voices. Find a single voice. And they kept us busy. Boy, they did. I want to take a seat for a moment before I conclude. Because I chose to actually play a video that was done by CARE, that I was part of launching, consulted on putting it together. Because this video, MEC, and all those online, explains exactly what will be happening at this center. Deputy Mayor, your leadership is outstanding. It is only people who believe in others that lead. And you did that. I was tasked to establish the homeless shelters. And in doing that, I found opportunities in what COVID was supposed to be gloom and doom. And amongst the best things that happened was, at least today you can ask me, how many homeless South Africans are there, and I will tell you. Because for the first time, we had them in one place. And for the first time, we heard them talk. We seen them, not by throwing money and food out the window that we open half, they were there. And that was an honor and a privilege to visit all these shelters, interact and spend time. I remember getting a letter from homeless people asking me for a TV. And I said to the department, can I have a TV? And the first official in the department said to me, what are homeless people doing with a TV? I was like, what? And besides, are they going to carry it on their heads or plug it up at the robot or what? I was like, yeah? So you guys put people in shelters and believe you disrupted their lives? And you tell me I can't give them a TV so they can keep up with their lives and know what is happening at their Sgoti? It was a real war, eh? And we fought over a TV. And I got to a point like, just unplug one of yours. You have too many in this house. Take one and just send it there. Because I understand the concept of homelessness. That there are people who are born who don't want to be in a space or in a house. They're not homeless because they don't have anywhere to go. They're homeless by choice. And that's the life they want to live. So let's watch the video. Enjoy it. I'll come back to tell you what is it I need to do next.
Once you're homeless, you grow up on the streets, you see things that's not right. You need help, but there's no help.
I got assaulted by the neighborhood watch about last week. They damaged the right side of my brain. I got a fit the day after that.
The most challenge that I'm facing is how people treat us, especially we women that are using drugs, is that the stigma that we get from our communities.
And it was very hard also seeing my child in the street. If I've got 10 rand, I throw 10 rand on the street so it come running. In the taxi they were asking why. I told them it's my son. It was very, very painful for me.
I was on and off the streets in shelters almost 30 years.
As people use drugs, we are marginalised a lot of the time because of what we choose to put in our bodies.
During the 2016 year, we had tests again. What happened is they told me I'm duly infected. I've got hepatitis C and HIV.
People who come from very vulnerable population groupings could be considered as denizens. They don't have full citizenship in this country. You know, they don't have full access to healthcare services because they're not seen as eligible almost for the rights that other people have.
And I think we have to talk about the elephant in the room. And the elephant in the room is probably stigma.
So the reality at the moment in 2020 is that we have a few harm reduction programs that include opioid substitution therapy, they include needle syringe services, and to some degree include some hepatitis screening and testing, but they're only in very few major metropolitan areas. And even in those cities where we do have those services, there's great further room for integration, and all of them have concerns to threats of sustainability.
Substance users did not have access to the services that we are providing. The only thing they knew was rehab, and the success rate, especially when it comes to heroin, was very low. We actually give all the information and they decide, they set their own goals, and it's our job to help them reach those goals.
What I normally do on a daily basis when I come out in the field giving out needles, the needle syringe program, and I also do behavior change interventions. When we normally give out the needles, we normally tell people about safer injecting.
The harm reduction program is so important. It helps us a lot not to spread HIV and hepatitis.
I would say my health is important. You know, I've come across so many risky challenges, especially with needles. I know that each and every fix I get, I must use a new needle.
But for some people, it's like we're encouraging people to spike up. They got the wrong mindset around the clean needles. And the reason TB HIV is giving that clean needle is try to stop spreading Hep C, AIDS. There's a lot of things that goes with that clean needle.
I would say some years ago, people were not aware that there are actually ways of dealing with substance use. There was really a despondency.
As there was no awareness on Hep C, and then that's when I started to worry about everything until recently.
Kuketsi for me is quite inspiring in the way that he's persisted in educating even before we had access to treatment.
It started in January, and then I was patient 0. I'm the first patient in the project.
I believe that a positive outcome for him will really be a new chapter in his life.
Being treated with hepatitis C and being cleared of it has given me just so much hope. Absolutely. So much hope in life.
I think for someone like Jennifer, what is important is that one doesn't see this through the lens of just some sort of a medical model. It's a treatment, harm reduction, and social support combination.
And what makes me proud of Jenny is she's in the cleanup. She's earning a little money, but from that money, she uses it wisely. She's paying herself the fees.
I've overcome all these challenges. I've overcome living on the streets. I got myself off the streets. I found myself a job. I started running again. I overcame the HIV threat. Now finally I'm going to go overcome the Hep C threat. There is nothing that I cannot do.
My dream is to see more centres like this. One on every corner.
Because it's working. And I am a product to show that it does work.
I believe we are sitting at a juncture in South Africa, and unless you actually realize that if you don't climb in now, the longer you sit on your hands and do nothing, it only becomes a bigger problem. We learned the hard way with HIV.
I think OST or harm reduction services must be part of the essential list of medicine so that we can get cheaper methadone.
You know, if we wanted to create a space of less harm for people who use drugs, it's really in the sort of space of ideology that we need to be working. Then we get a critical shift in understanding who people who use drugs are. And so caring means understanding the humanity of people who we've kicked aside onto the streets and into the prisons.
We know what the problems are, and we have the solutions to start overcoming these challenges. What we need is societal support and political action now.
Behind every patient's face, behind every service that will be rendered here, as we're not only launching SANPUD as an organization, the South African Network for People Who Use Drugs, we're also launching Belhaven Memorial Center as one of those. So I chose to play that video because sometimes when we talk, as politicians, we get lost in translation. So I said, I want to play this video so that those that have seen value in the services that eThekwini, in partnership with SANPUD, Durban Technology, TB Care, and all of the partners that are going to be making sure that our girls, our boys, our gents, our lady, abo taima, nabo olady, get the services that they have a sense of when this center is in full capacity, MEC, Deputy Mayor, that is what we expect. So that is a center in Cape Town. And now we are here. So can we strengthen this organization? Caesar, can we make sure that it's part of every person's package when they get discharged from our rehab facility, so that they can reach out to their own and they can talk their deepest without fear or prejudice. So, as from today, it was a sideshow. You all heard about SANPUD, it's here. We're giving people who use drugs a voice. So guys, stand up. Bomchana. On your feet. So remember, united we stand, divided, good. So SANPUD is duly recognized, Angela. You have a seat on the table as drug users. At no point will government have dialogues and discussions about you without you. And no official at any level of government will have an excuse that says we don't know where to find them. As from today, every parent that's struggling with a child will know where to get help. So SANPUD, it's officially launched. And Deputy Mayor, MEC, Prof, Belhaven is officially opened. We made it, guys. We did. Whew. We made it. We made it. We're here. They can't take us back, right? Good. Thank you so much. My last job is to take your seats, guys. They can't make us disappear even if they want to. We're here. And we're here to liberate ourselves from the shackles of drugs in our own rules, our own way, but with better support and understanding. So, you all heard, I'm asked by Ntate Motlanti to read, so pretend I'm now, very nice to be a deputy president and a president. Yeah, guys, we shall also arrive, man. It's not every day you get to read that message. But it's not every day. He asked me to read it because he didn't want to be recorded. But he was also not sure whether the network is going to be stable. But he is here, listening. He is here, and like me, you must know that amongst the madness, you have a champion in the name of Kgalema Motlanthe. As drug users, you have a champion. So let me pretend, so now, let's change the look. That's what they do there in the showbiz. So let me try and be an actor. So let me read the message by His Excellency, former President Kgalema Motlanthe, at the launch of the SANPUD as a strategic partner to the National Department of Social Development on the 28th of October, 2020. And he's acknowledging the program director. HOD, you are acknowledged. He's acknowledging me. Thank you very much, Your Excellency. Prof, Max, all of the health workers, the users, the volunteer, the academics, MECs, mayors, councillors, and the most important, the people who use drugs. Dumelang. Sanbonani, Mzansi. I'd like to start by thanking the National Department of Social Development, the South African Network for Persons Who Use Drugs, and the Bailhaven Memorial Center for hosting this important program at a time when the people of South Africa and Africa are in desperate need for drug policy reform. South Africa and the world are experiencing extreme disruptions amidst the COVID-19 pandemic, and together with the compound effect of existing economic, health, and social crisis. It is sadly too often that our country's most vulnerable people fall through the cracks. As history will tell, whether during times of relative certainty or during times of national disaster, key populations are overlooked and escape notice. As we celebrate the launch of the strategic partnership between the National Department of Social Development and the South African Network of Persons Who Use Drugs, we recognize the power of collaboration to increase knowledge sharing, expertise, the efficient use of resources, and to take notice of the people who deserve our utmost attention. It is through increased partnerships and collaborations that we find most effective solutions. And as a member of the Global Commission on Drug Policy, that's not me, people, and as the chairperson of the Champion for an AIDS-Free Generation in Africa, my address to this gathering is informed by the work of these two organizations. We believe that future policies need to be built on inclusive ecosystems where different stakeholders can exchange and find solutions for the many issues facing the challenges currently drug policy, such as criminalization, poses. The criminalization of drug use and possession is at the core of the world drug control policy problem. The vast human rights violations resulting from these policies and the negative impact on communities, on safety and security, on the spread of violence, and on the public health based on the analysis of available evidence and research. The Global Commission has found that the criminalization of drugs is responsible for numerous human rights violations, as well as was also stated in reports of the High Commission for Human Rights and many other international and regional human rights mechanisms. The Commission has also found no evidence on the efficacy of criminalization and reducing the demand, the supply, or the unintended consequences of prohibition. Rather, if the drug control regime wants to reduce the unintended consequences, it would need to change its strategies, something which we advocate for around the world today. Moreover, the criminalization of drugs puts people who use them at risk of suffering legal sanctions, as well as going through daily social stigma and discrimination. As the chairperson of the AIDS-free generation in Africa, our focus addresses difficult issues of leaving no one behind. We have committed to take on complex issues, to expand access to health and HIV services, and leave no one behind in the real sense of the word. We are dedicated to advocating for increased commitment to address political, social, and legal barriers and blockages that continue to hinder our progress in attaining health development goals and an end to AIDS in Africa. It is important that we represent and imply the voices of those who are not readily heard and seen. And we encourage dialogue on these difficult issues because change begins with conversation. However, self-representation is fundamental for an authentic dialogue, and sufficient consideration is not given to the voices of people who use drugs, the marginalized and the decriminalized. As government, society, and leaders fail to even listen. And as a result, people suffer unnecessarily painful consequences. Their stories often go untold and are lost in a barrage of ineffective policies, misunderstood signs, and cruel social stigmas. Program Director, what we must consider is that our response to vulnerable communities in the past did not work. We must admit that there are massive gaps in our current policy and approach, and that in many ways we were wrong. The force used against our people in the war against drugs only served to isolate people further, to reinforce dangerous stigma that increase marginalization and fuel drug-associated problems. These were mistaken, and leaders in Africa should learn from them. We must now seek for what will work, honestly, humanly, and justify, and it is through strategic partnerships between National Department of Social Development, government as a whole, the South African Network of Persons Who Use Drugs, NPOs, NGOs, community leaders, and active citizens that we will begin to restore the humanity that is sorely needed in this country, the beautiful South Africa. Today, a spotlight is shown on the positive work of Belhaven Memorial Center as a showcase of the potential of our country to take bold strides in the direction towards harm reduction and support. The essential work of the project team of registered nurse, social workers, researchers, volunteers of Belhaven Memorial Center is an excellent example of how innovation, evidence-based research, science, and compassion can make a massive impact on the community. The Belhaven Memorial Center project leader, Professor Marx, and her team demonstrate how our urban spaces can be reshaped for human dignity, and how our policies can be recentered around support to help people navigate their way through hardship. More support for public-private partnership models, such as the Belhaven Memorial Center, is needed in urban centers across South Africa and the continent. And we wish them ever since in their plans to open Africa's first overdose prevention space within Belhaven. Program Director, To understand citizens who have been sidelined by society and who are suffering is to show that we care for them. To care for the vulnerable is to do our best to offer them every chance for them to heal, to be seen, and to be heard. Let us give a voice to the marginalized and make sure that vulnerable communities are afforded the rights given to every person in South Africa. As I conclude, I must ask the question, can true, oh gee, it's hot, and the lights are not helping. As I conclude, I must ask the question, can true prosperity ever be achieved if our most vulnerable are left behind? We are all a composite of humanity, and therefore every person is vitally important in the project to create sustainable, equitable, and inclusive society. A roadmap for prosperity and progress is meant to leave no one behind. And so we commend the National Department of Social Development, the South African Network for Persons Who Use Drugs, the Belhaven Memorial Center, TB HIV Care, and all the organizations and individuals who contribute to this essential work for their efforts to ensure that we all walk together. We thank you, Deputy Minister, for your hard work, allowing to be sent to new spaces and allowing your leadership and your voice to be heard. Gentate, Khalema Motlanti. Signed and sealed, guys. Signed and sealed, so I can't add any of my words. All the media will get the speech, and everybody else that wants it, it's there to be circulated, to be shared, to be displayed, to be referenced, and above all, for all of us as drug users, as drug recovering addicts, as whatever, we have a champion, we have a leader who walks the journey with us. Thank you very much.
We need that standing ovation, colleagues. Another round hand of applause for the Deputy Minister and the former Deputy President. Thank you very much, Deputy Minister. That was powerful. The video, the speech, and the speech by the former President, Untate Khalema Motlanthe. That was powerful. I would now like to call Umthobisi Nonhlakanipho. Umthobisi and Nhlakanipho, are you there? Hi, well, let's welcome Umthobisi and Nhlakanipho.
Hello, everyone. My name is Mthobisi. I'm going with my partner. There is a song we're going to sing right now. It's against this virus, coronavirus. Yeah. Yeah. Lolu shunwami we. Yeah. Yeah. Talent lami. Yeah. Mama. Lapha emhlabeni akusekho ukujabula. Ayisekho injabulo. Hlale sikhala njalo. Lapha lapha emhlabeni akusekho ukujabula ayisekho injabulo hlala esikhala njalo yezibhlungu ayipheli yezibhlungu ayipheli yezibhlungu ayipheli hlala esikhala njalo yezibhlungu ayipheli yezibhlungu ayipheli yezibhlungu ayipheli hlala esikhala njalo yelele mama yeah yelele mama we kwaphela isizwe nje kwaphela abantu nje
sure cela ningizwe mangikhuluma ningabi nithi ngicika nami lo mthwalo usuyakusinda ingakho ngithula lo mbingi umuntu nomuntu kumele azibheka akekho umuntu onemlingo ubheke zakhe izindaba futhi ungavumi bakuxhophisa izinto ezenzeka kulomhlaba msho sonke sizibonile sizozalana izilwane zodwa thina sigcine siphelile inkinga yethu asinake kanti nazi izifo ziphokile asithandaneni sikhuzaneni nakuma drugs afikile noma ungangibuka unyanya kodwa ivari kumele iphumile bheka nabantu ozwana nabo khona ohlele ekobile ngobile genge lengathanda ukubona umunye encumile endabakhozi bayajabula uma bekubona wonile izinto zishintshile futhi mobheka inqondo ikhulile usathana ufikile ngapha nempilo kumele ibhekiwe umhlaba usixakile basile khona basawuzibile mina into engizoyenza ukukhohlwa konke sekwenzekile
lapha emhlabeni akusekho ukujabula ayisekho injabulo hlala esikhala njalo lapha emhlabeni akusekho ukujabula we ayisekho injabulo hlala esikhala njalo yezibhlungu ayipheli yezibhlungu ayipheli yezibhlungu ayipheli hlala esikhala njalo yelele mama yeah yelele mama wo yelele mama yeah kwaphela abantu nje
futhi akusazi ngoba manje ujikelwa namkani so ivari kumele uzibheke wena uzazi ufunani ungabothemba omunye umuntu ozobecikela phansi noma kumnyama ubekezele sazokukhanya lesibani isizwe siphendukile nami ngiyazibuza kanjani angithi majority sikholwa kuyona kuphilo nemali philwa kamnandi sikhohle bese silahla amasiko kwabanye kaphanto angithi phela kufunwa lempilo isizwe siphendukile kulo mhlaba kwenzekeni sonke asazi vele ukuthi uNkulunkulu usidaleleni akuyona impilo le ekumele iphilwe emhlabeni kube khona abalahla amasiko nje esikhaleni uma uzala ingane bese ayilahle esigangeni phuma isibhamu ubona igazi emgaqweni obvious khona oshonile bembulalela usheleni ngoba noma ubani ufuna ukubona imali ephaketheni sengiguqa ngedolo ngiyabuza mdali senzeni kulo mhlaba osilethe kona sonke saphila ephutheni ngisho mdala emncane ubona inyembezi emehlweni kodwa ngiyazi ukuthi wena uzongiphendula emaphuphweni
lapha emhlabeni akusekho ukujabula ayisekho injabulo hlala esikhala njalo lapha emhlabeni akusekho ukujabula ayisekho injabulo hlala esikhala yezibhlungu ayipheli yezibhlungu ayipheli hlala esikhala njalo wezulu omnyama uthe masibuye masisweni sibuye kanjani mase kunjena wezulu omnyama uthe masibuye masisweni sibuye kanjani mase kunjena awuyelele
yelele
wololo yelele zulu omnyama kandaba awathi cause all my phiko nyonyezu cela uhambe nami yewena cause all my phiko nyonyezu cela uhambe nami uyongibeka welude izwe yelele mama we
Sanibona. Ninjani? Igama lami ngumenzi wakamavundla mina. Nami ngomunye abantu ade besebenzisa ama-drugs kodwa sengi-right manje. Cela ukubonga uNkulunkulu. Ngokubonga uNkulunkulu ngokuthi alethe abantu abanjenganani abakwazi ukuthi basisase emgaqweni, basise emasayithini, bakwazi ukuthi basilethele izinto zokuthi ama-skills development. Nginje ingenxa yenu nabanye benu nongekho la ngiyacela ukuthi nishayele izandla nina ngokusiza impilo zethu. Ya nami ngizonikhombisa elinye lamathalente ami ngoba nginamathalente amaningi ngiyadweba njengoba nibonile lapho ngizonikhombisa elinye lawo. Bring the beat on. Huli. Check. Amazing grace. Music, it's amazing grace. Music, it's amazing grace. Yeah, I'm the king with the words. From credit to grave, I'm about to stand on the mic and put it down like a grave. I'm like our father, my heart is like heaven. I'm giving you this daily bread. Thick women vacuum middle fingers up if you're pointing a pistol in my face. They say report you so I plan rude for evil. I hope I won't harvest the veil. Unlock my eyes and see they call me my dog, but they didn't be me yanking nail. Got them up and down the carriage. Every time I speak, they take notes like ATM. My sound proves to be best. I'm MIA, I'm the ghetto speaker. JPL. First approach, I'm flowing a blank face. You tell it in your chest, I said it like it is. It is what it is. Niggas holding a crutch with a noun fist. Fuck, I cracked the shit. Now you aiming fingers, I thought you will resist. It's hard to believe. Show this weakness, toxicate like rose. It's a disease, it's bullshit disease. Music, it's amazing grace. Too short street joint, I'm smashing before I hop on the stage. 80 of my hustle, I couldn't matter to the rest of my days. Trying to conquer the world, pinky and the brain. Hey, music, it's amazing grace. Too short street joint, I'm smashing before I hop on the stage. 80 of my hustle, I couldn't matter to the rest of my days. Trying to conquer the world, pinky and the brain. Hey, amazing grace. Amazing grace. Amazing grace. Check it. Holy so proud of the skin, but I'm letting your nights I survive with my mind. They say live by a can't I can't live by my round killing with this bloody bars. In the cool my spirit, exhale, explain myself poetic bars. Fuck what you heard, always thinking ahead. I'm the head of this game, follow tails. Exhibits in the duffel bag, running and never look big. I'm Schumacher with the sex drive, fit to any human race. No speed limits, I'm riding the page. Music, it's amazing grace. If you want me to take care of you, shorty, I put a leash in your neck. Wake up to my hood, every weekend is wicked, always going down with the best. I'll be pleased if I reach my destination before the dates on my death. Damn, trying to be something, mommy, you didn't cry for nothing in dates on my bed. We linger my team, we Jeremy conspiracy, but I'm still manning to pay. There's no time to waste, I'm giving them taste. I say like sooner than late. Go pick or go home on the microphone. Your work doesn't match your talk. They are program, something that I miss. Every time you learn, you gain. We like to blame others for our shame. Don't follow, I'm paving my way. Music, it's amazing grace. Too short street joint, I'm smashing before I hop on the stage. 80 of my hustle, I couldn't matter to the rest of my days. Trying to conquer the world, pinky and the brain. Hey, amazing grace. Amazing grace. Amazing grace. Hoodie, yeah.
Ay, Chovicho, kumenzi, Chovicho. Deputy Minister and MEC leadership, I want to be part of this band, really. You! That was beautiful. Are you still there? Nisekhona? Thank you. We are almost there. At this point in time, I would like to request Professor Monique Marks of Urban Future Center. Professor Marks is going to give us the vote of thanks. Professor from DUT, you are welcome, ma'am. Thank you.
Afternoon, everybody. I was supposed to give a vote of thanks, but it's a pretty bad idea to tell me what to do. I'm not very good at that. And also because I think that most people have been recognized who should be recognized in the room. So I'm going to say a couple of things in conclusion, if that's okay, Program Director. There are a couple of things that come to mind and that I just wanted to raise. And the first one is that we sit at the moment in a country where we feel a little bit despairing when we watch the Zondo Commission in particular. Today, what we see before us are political leaders and are heads of departments who have huge integrity and who are incredibly progressive. And for them, I am deeply grateful. They are sitting with us today on the stage. And apologies from the Deputy Mayor who had to go to a council meeting at 12 o'clock. She is included in that leadership, which we so need right now in South Africa. So many thanks, Deputy Minister. Many thanks to our MEC. You are appreciated more than I can possibly say right now and always. Why is it important for us to recognize the launch of an organization like the South African Network of People Who Use Drugs? For me, what SANPUD does is it reminds us that every single one of us are fractured, that we are incoherent, that we are contradictory. That is the nature of what it is to be human. And perhaps it is in networks such as the South African Network of People Who Use Drugs that we more honestly recognize who we really are as human beings. And so I think today is an important day of a recognition not only of a particular group of people, that is people who own up to using drugs, but all of us who are fragmented, incoherent, and inconsistent. Myself probably being the leader of that pack. And in those moments of fragmentation, of inconsistency, of incoherence, we make choices which are sometimes good and sometimes bad. And let us recognize that in this, we stand in solidarity with one another. And for that reason, it is incredibly important that we honor organizations like SANPUD. Having been on this journey of recognizing the rights of people who use drugs for many years now, I think that it is no understatement to say that what is happening today at Belhaven Harm Reduction Center, which is what we are, is nothing short of a miracle. There are two reasons for this. The one reason is that for years and years, what has been pushed down our throats, those of us who work in the area of harm reduction and drug use, and those of us who are drug users, has been prohibition and abstinence, both of which have not worked. So for a ministry such as social development to stand up and to launch the South African Network of People Who Use Drugs and this center, the first most comprehensive harm reduction center so far in the country. We're going to be blossoming all over the place. We've now been told that this is a formal launch, and that is incredibly significant. So this is a big moment, and you know, Deputy Minister, when you spoke, it takes a lot to make me feel weepy and stuff like that, and I really felt like everything in me had been shaken up, because you recognize us, all of us. And I thank you from the bottom of my heart for that. I cannot express that more deeply than I already have. On the video earlier today was Sean Shelley representing SANPUD. I met Sean in 2015, and we had a dream. We had a dream, and that dream was to make opiate substitution therapy available to South Africans. It did not look possible. It looked like just a dream. But we fought really hard to make this a reality with everybody that is here today. And that has been a journey worth walking, together with people like David Bayeva, together with the Deputy Minister. It's been a difficult journey. It's been well worth it. And we see that in the amazing people that we have here today, some of whom I want to mention. Our clients or our beneficiaries, our colleagues, the people who make use of the center, thank you for sitting through this and for your amazing performances, and for the support that you provide, not just to one another, but to those of us who activate this center on a daily basis. I always know if I'm not feeling okay, for whatever reason, the first people that will pick it up that I am not feeling myself will be people who use the center. Guaranteed. Guaranteed. They will see it in my face. They will see it in the way that I walk. They will see it in my interactions. And for that support, I personally am incredibly grateful. There are some people here that have not been recognized yet, and I just wanted to notice them, and I'm not going to note everybody. But I do think it's important for us to know that at Belhaven Memorial Center, we have a group of 3 registered nurses who are here 7 days a week. They are at the back of the hall. I'd like to recognize them. If you could please stand. One is busy doing the program, but she is there. So Carla and Renelle and Leonis is outside. Without those 3 nurses, this program would not exist. Secondly, I have to recognize my partner in crime, Michael Wilson, who is at the back. Michael we have been by each other's sides from the beginning of lockdown until now. There's not a single day that I do not speak to Michael. It's unusual that I don't see Michael, but it's been quite a craft to get this together and to have it functioning. And Michael has played an incredible role in doing that, and without Michael, this would not be happening. I can tell you that now. TB HIV care has already been recognized, so I'm not going to recognize them here again, but the social workers who work for TB HIV care and for us as Belhaven Memorial, I would like to recognize them because they are the people that listen to those of us who are members of SANPUD. Can the social workers please stand up? Annalise, Klaus, and if Taurus is here. Some of them are not here today, but they are the people that do listen. And so we have psychosocial support here on an everyday basis. And the other people that have not been recognized are 2 photographers, Angela and Lisa, who have been responsible for taking these photos that you see on the walls. And I want to explain them very briefly to you. So Angela and Lisa, please stand. These photographs that you see were taken in the underground parking of Moses Mabhida Stadium, where many of the people here today stayed for 12 weeks of the first period of lockdown, level 5, level 4, and part of level 3. And many of us that are here today worked in that underground parking lot for 12 weeks. These pictures depict what it was like to live in an underground parking lot as home under the forced regulations brought about by COVID-19. What you will see here is not only the living conditions and how amazingly neat and tidy and organized those spaces are, but also the way in which people brought belief systems and religion into that space. And there's also a section there on, and how important that was, bringing medical assistance to people who needed it during a really crazy and chaotic time for all of us, but particularly for people who were forced off the places that they knew best, the streets on which they were living. So please take some time and take a look at this photographic exhibition. I'd like to really end by saying a huge thank you to everybody who made this a reality, including our H-Factor, who were responsible for all of the assembling of what we have here today, including the videos, including the stage that we're standing on, including organizing at the last moment cleaning of this place, which was incredibly chaotic yesterday. So thank you to H-Factor. And as we leave here today, I really, really just want to say to everybody who has spent this morning here with us, thank you for sitting here in the heat. Thank you for showing your support for what we do here, not only at Belhaven, but also for a network which is going to grow in strength and who we will be looking for guidance from as we go forward. I think it's really important to say that when we did set up the program, the methadone program in the underground parking lot and later on in Albert Park and now here, SANPUD provided a huge amount of guidance and support for us to be able to do this. It was not an easy thing to do, to set this up in a very short period of time. So in all, Program Director, all of those who have spoken so eloquently today, including our MEC, who I haven't recognized yet, but I do recognize as one of those leaders who is forward-thinking, who has integrity, and who has the concern of vulnerable people at heart more than anybody else, which is what we need. Let us put vulnerable people first, and then think about the rest. People tell us that COVID has taught us that our lives are interconnected. But I'm not sure how much we have taken that to heart. I'm hoping that today we recognize how connected we all are, not only through care, but through an understanding that we are all fragmented, incoherent, inconsistent, as we are humans. Thank you very much.
Lastly, we all made in the image of God. Thank you, Prof. Can we give Prof a round hand of applause? Thank you very much, Prof. I'm not sure whether you can thank a person who passes a vote of thanks, but thank you. Thank you very much, Professor. That was beautiful. We have come to the end of our program this afternoon, and thank you very much. You were so good. Even those who have put down their masks, but they still have them, and the social distancing is still there. Please be safe, wear your mask, wash your hands, keep social distancing. There's still a lot that is waiting for you out there. There's still life. We strongly believe in you. the success of this launch, it shows that there is a lot that's still going to be achieved by the people who are dedicated to this program. We thank you very much. I want to make one last announcement. We will allow the leadership in the front to leave first, and then the rest will leave. There is lunch on our way out, so there are food packs that are waiting for us, all of us. Thank you. Thank you very much. May God bless you. Thank you. Thanks, my prof. Thank you. I'm a DUT graduate. I did a part-time